Hi, I'm Dr Sheehan. Welcome to Queensland Vasectomy. Please take your time watching our video and also having a look through our website. It will answer most people's questions. If you have anything specific or we haven't covered, please just give us a call or alternatively ask me on the day of your vasectomy. Thanks. What questions do you have in particular about vasectomies?
So what actually happens here? How do you do it?
I think it makes a lot more sense with a picture. So if that's the scrotum, penis off to the side, I'll put a little bit of anesthetic right in the skin on the front middle part of the sac of the scrotum. It stings a little bit. It takes about 10-15 seconds. Then once it's numb, I'll make a piercing through the skin right in the front middle part of the scrotum, right, like kind of in the middle. So it's only about 1 millimeter or so. It's just like an ear piercing. Inside, there's 2 testes, and they each have a vas deferens, which is the tube that carries sperm away from the testes. I'll be able to bring that tube right up to the middle of the front middle part of the scrotum where that piercing is. And then through that little opening, I'll cut the tube. That's with a hot wire, a cautery wire. And the reason we do that is it will seal off any little blood vessels or nerve endings at the same time. Then we use the same wire on the top part of the tube to seal that up. Usually as that happens, the tube folds back on itself and points the other way. There's also a very thick membrane or a sheath, just like an electrical sheath, that runs alongside the tube. And I'll fold a little bit of that over the top end of the tube to act as a barrier. And that way there's a physical barrier between the 2 ends to also help stop sperm getting out. Obviously, if you leave it like that, there's a chance the tubes can start to touch each other again. So to hold everything in place, there's a little titanium clip that sits just there and stops that from happening. You still make sperm in the testes. They'll just come out the end of that tip and get reabsorbed by your body, and your body just keeps, recycling them into new sperm from the old sperm. So we'll do one side and then drop that back, and then almost always I can get the second tube out through the same piercing just in the front middle part of the sac. That titanium clip is only about 1 millimeter long, and it's a fraction of 1 millimeter wide. You would have a lot more metal in any dental fillings. It'll take about 15 minutes, and then you're fine to drive home afterwards.
Will the titanium clip be there forever?
It will stay in there forever. Some guys call up because they feel a small little lump and they worry about, is that the clip that they're feeling? It's not. It's just that little bit of the tube where it's doubled up and folded back on itself. Some men feel that as a small, tender, kind of pea-sized lump after their vasectomy. The clip itself sits in the gap between the 2 ends of the cut tube, and it's a lot thinner and smaller than the tube itself. It's physically impossible to feel the clip.
Is it gonna hurt?
It's a little bit uncomfortable. It's nowhere near as bad as what most guys are expecting. You probably feel a little bit more than getting stitches. It's nowhere near as bad as getting any dental work, any fillings. So usually when men leave, they feel fine because the anesthetic is still there, and so it's still numb. So that's your time to just get home and get set up with some ice packs and on the couch. Usually the anesthetic lasts for about 3 hours. So when you start to feel sore, and it'll probably feel like a bit of a dull ache, like one of your kids has jumped into bed and given you a little tap, or, after, if you've been hit by a soccer ball a few hours ago, that dull ache. When you start to feel uncomfortable, that's when you should take the medication we give you, which is an anti-inflammatory. As long as you go home and rest and put your feet up, most guys are pretty good. But as it's uncomfortable, you should take some Nurofen or Panadol. To give you a bit of a guide, about 25% of the guys don't take any medication, even though we give them some to take home. About 25% of guys take that, that one dose, and then that's it. But most guys take Nurofen or Panadol, for about 2 or 3 days, just depending on how active they are.
So how long will it take?
So Chris, once you arrive, just park downstairs in Hurston Health. Then come up the stairs to Hurston Health reception and ask for Queensland Vasectomy. They'll give you an iPad and a video to watch that runs through most things and answers most people's questions. Then you'll meet me. If you have any more questions, I'll run through them and help you where I can. And then we'll get down to the vasectomy. You lay down, takes about 15, 20 minutes, and then we're done.
When will I be able to have sex again?
So for running, going to the gym, having sex, bike riding, anything too physical, you should wait a full 7 days. And that's even if you feel good, just wait 7 days. Some men get a little bit of blood come out the first time they have sex. It's all right. It's just no need to freak out. It's just part of it healing.
What about exercise, like running or cycling?
So same, just wait a full 7 days.
Should I use an ice pack?
Yes, definitely. Ice packs, frozen peas, just something cold. And the more you use today, the better you'll feel tomorrow. You want to just put that right on top of the pubic bone, through some shorts, not directly on the skin, because, obviously, and 20 minutes on, 20 minutes off.
How about the test? How do I do that?
So, Chris, the test is really important because the tubes will try and heal back together, and if it does, you'll find out about it. But it's a lot easier finding out with the test than with the real thing. So it's very simple. It takes about 20 ejaculations just to empty out the sperm. So you need to wait at least 20 ejaculations before you do the test. And also wait at least 3 months, because that's the real danger time for rejoining back together. And so sometime after that, just at home, in the jar, ejaculate into there. It's not like in the movies where it all fills up. It's only the tiniest little amount, so don't worry if there's only a little bit in there. And then that's the slip that goes with it, the pathology slip. And so with the jar and that slip, take that into QML. They'll test it, look down a microscope, make sure there's no sperm in there, and then we'll get the results a few days later and give you a call. Now, don't do that there's no place there to do it. Don't do it in the car park. Just do it at home and then drive it in. But you do have to be, you don't have all day to get it to them. You've only got about 2 hours before it needs to be tested. So do it at home and then drive it straight in. So also let them know that you're going to come in the day before. Only the larger, bigger QMLs will actually do sperm tests. It's not like all the corner suburban ones that do blood tests. They all do blood tests. Only the larger ones will do sperm tests. So if you look at their website and just change from the collection centers, change standard test to seminal fluid test, you'll see the places where you can drop it off, and give them a call the day before to let them know. Because the last thing you want to do is turn up there and, then them to say, oh, that person's away today, or they're gone to a course, and then all of a sudden you kind of wasted your day and you got to do it again.
Does the test cost anything?
It does, and that's a separate charge to Queensland Vasectomy, because that's their independent company. Usually costs about $50, and then you get about $20 or so back from Medicare. I think it ends up costing about $30 overall, but don't quote me on that.
So does stuff still come out?
So Chris, it does. all of that sugary goo comes from the prostate, so that still comes out, but the sperm itself doesn't. So if you look at it under a microscope, there's no little tadpoles swimming around.
Should I shave down there?
So please shave before coming in and have a really good shower. Shaving definitely makes things a lot easier, reduces the chance of infection, and also if you don't shave, I don't do it on purpose, but I'll usually end up kind of pulling out a few pubic hairs. So definitely please shave. And you want to shave more rather than less. Shave the entire scrotum and even the inside of your thighs. And for men who are particularly hairy, even a little bit on top. Yeah, the more you shave, the better. Some people ask about the hair removal cream. Well, they'll turn up after using the hair removal cream. Please don't, because it will remove the hair, but it will also remove a top layer of skin, and it hurts. So equally, don't use a beard trimmer because it can pull hair out. So really just use a fresh, sharp razor in the shower. Take your time. Obviously, be gentle.
Can I claim this on Medicare?
Yes, you can claim back on Medicare. So when it comes to doing the payment, you'll swipe your bank card or credit card once. The full amount of money will come out of your account, and then a few seconds later, the machine talks to Medicare. You swipe your card again. It can't be a credit card. It's got to be either a savings or debit card, and Medicare will put the rebate back onto that card.
How soon can I go back to work?
On the day of the vasectomy and the following day, you really just want to rest, put your feet up. I mean, you can answer phone calls or emails, but try not to walk around too much. On the third day, you can go back to work doing anything. If you have a bit more of a physical job, maybe take some Nurofen or Panadol just in case. But most people are fine to go back to work on the third day.
Will there be any stitches?
No, Chris, there's no stitches. The wound itself is tiny. It's almost like you cut yourself shaving. Leave it alone and it'll heal, within a day or two. In a week, you won't even be able to see where it was.
So what happens if it rejoins?
We do it again. If it rejoins, you'll find out either with the test or with a surprise. Just let us know. It won't cost you anything to do it again. We will simply book you in and reschedule a time. We'll try to fit in around you to get it done as quickly as possible. You're still a bit sore for a few days. We go straight back in the same hole, separate the tubes out a bit more, and then you go again. And obviously you need to test again 3 months after that. It's not common, but they do pop up from time to time. It's about 1 in 700 that rejoin.
What things should I look out for after it's all done?
So most guys, when they leave, feel fine. Then after, because it's still numb, usually their local anesthetic lasts about 2 or 3 hours. And then you start to get a bit sore. You start to feel a bit of a dull ache or pressure feeling in the groin. When that happens, there's some tablets in here to take. So that's just paracetamol and an anti-inflammatory called naproxen. They work really well together. So, once you get home, the anesthetic's wearing off. After a few hours, just have them all together in one go. And then Panadol, Nurofen kind of stuff for a few days, as you need to. Most guys take that for a couple of days. A little bit of swelling is normal, so 2 eggs is fine. If you get an avocado, give us a call. Equally, on the skin where that piercing is, it'll ooze a little bit, just like if you have a blood test, it oozes a little bit. Usually within a day or two, it's started to heal. The main thing with that is just leave it alone. Some bruising is normal. most men get about a 10 or a 20-cent coin kind of bruising. Some men get even the bottom of their penis and the inside of their thighs all go bruised. It's fine. It's just a cosmetic thing. Bruising is usually worse after a few days. After about 4 or 5 days is when the bruising's at its worst, and then it will just slowly fade away. For that first 2 days, you really just want to go home, put your feet up, not walk around. That's the classic mistake men make, is they start to get bored and they potter around on that first couple of days doing too much. So even if you feel good, don't walk the dog or mow the lawn or go shopping. Just put your feet up. And then on day 3 is when you can kind of start to get back to most things. And you can do pretty much everything except, running, have sex, go to the gym. It'll still be healing for a few weeks or months. So it's not uncommon over the next couple of weeks to feel completely fine, and then every now and then just to get a little twinge or a little flick, and then feel a little bit sore again for the rest of the day. That's fine. It might only happen once or twice. It might happen a handful of times. It's just part of the healing process. Equally, some men do find or feel a small little lump on each side, and they're worried. It's fine. It'll be a little bit tender because that's the side of the vasectomy and it's healing. The main thing to do is just leave it alone. Don't rub it, because some guys do kind of, it hurts when I do that, and they'll rub it, and then they'll stir it up and make it worse than what it needs to be. So really just leave it alone. Equally, some men are really surprised. They feel a lot better than what they're expecting over the first couple of days, and it's only until later that they start to feel sore. So if you do kind of get to day 5 or so, and then all of a sudden you're sore, it'll probably be just because you're starting to get back into things and the inflammation has taken a little bit longer to evolve. It's fine. Just start some Nurofen or some Panadol, some anti-inflammatories. If that's kind of persisting, and you've been on those tablets and it's getting worse rather than getting better, can you please give us a call? Some men, about 1 in 200 men, will get an infection and need some antibiotics. So if you do feel hot and clammy, like if you get a fever, can you please give us a call? Because we can sort out some antibiotics just over the phone for you and save you going into the GP. Some men call and they get worried that one side feels fine and the other side is sore. It's fine. Most men kind of just feel it a bit more on one side because one side's a bit tighter than the other. It's nothing to worry about. Some men call because when they're laying down they feel fine, but then when they move in certain ways, or particularly sitting down and getting in and out of chairs, they'll feel it then. It's fine. It's just healing, and it's just the movement that's causing that.
So is that all there is to it?
Pretty much. There's a couple of things just to be aware of. It's pretty much common sense, but we might just run through them together and make sure we've covered everything and all your questions. So obviously, if you got an infection, we'd sort out some antibiotics for you. Bleeding, really, the men on blood thinners like warfarin and aspirin, we get a little bit more excited with bleeding. You'll still have sperm coming out for the first few months, so please make sure you use condoms or the pill or some other form of contraception until we give you the all clear with your test results. They can rejoin. That can happen at any stage, but from a practical point of view, it's almost certainly going to happen in the first 3 months. So we want you to do the test after that 3 months, and that's why we get you to do the test in case it's rejoined. The reversals are very good, but they're not 100%. They're maybe 60% effective, and the longer you leave it, the less likely it is that a reversal will work. So the idea with a vasectomy is we only do it once you're completely confident you don't want any more children. Some men will get a little bit more inflammation than other men, and so the normal over-the-counter anti-inflammatories like Nurofen really don't work well enough for them, and they'll need a prescription for some stronger anti-inflammatories. That's rare, but it does happen. In really extreme cases, that can go on for a few months, but again, that's a very rare thing. Some men will get a buildup of sperm, and the back pressure will cause like a congestion kind of ache inside the testy. It doesn't happen as much anymore because we leave the bottom end of the tube open for sperm to come out, whereas years ago we used to put a stitch on that end and close off both ends of the tube. So that's why we leave it open nowadays, so sperm have somewhere to go. But for those men, someone really needs to go back inside and open the tube up and relieve the pressure. That's maybe about 1 in 30,000 men who have to have that done. It's very, very rare, but sometimes if there is a little bit of bleeding or a lot of bleeding from that little piercing through the skin, I'll put a stitch in there to help close it and hold it together. The danger with putting a stitch in is then you've got something foreign that the tube can join up to and heal up to. So again, that's very rare, but sometimes I have to put a stitch in. One thing you should be aware of is almost everyone just drives in and drives themselves home. But if you're feeling at all woozy or dizzy, just chill out and have a juice or, a soft drink first. There's no rush. So, if you feel a little bit dizzy afterwards, just, say something and, chill out for a few minutes before you drive home. More people faint getting a blood test than getting a vasectomy, but we always, we want you to get home safely. At the end of the day, we just want this to be as easy and as safe as possible for you and your family. So, Chris, the hardest part's just turning up, and you've already done that today. If you don't have any more questions, we'll get started with the procedure. Thanks for watching the video. Please just take a seat and relax, and we'll be with you shortly. If you have any further questions, please just ask me in the consult room.